Hi, welcome to my YouTube channel. We have a special guest today. It's Dr. Emily T. Rowe, and we're going to be having a conversation about Lyme disease. So first, I just want to start with my standard disclaimers. The information discussed today does not constitute medical advice, diagnosis, or treatment. It is not a substitute for professional medical care and does not create a physician-patient relationship. Similarly, the information discussed today does not constitute legal advice. It is not intended to be a substitute for advice from a qualified attorney and does not create an attorney-client relationship. On the contrary, the views and opinions expressed today are solely those of me, Susan Lee, and do not reflect the views, positions, or policies of Biogeometry Energy Systems Limited and its affiliates and the National Call for Safe Technology. So now I want to welcome Dr. Emily T. Rowe. I'll first read her biography, which is really amazing, and then we'll get on with Lyme disease. So Dr. Emily T. Rowe graduated from the University of Miami Miller School of Medicine in 2004 with a doctorate degree in medicine. After a brief time in the field of internal medicine, she became frustrated with the conventional medical approach to illness. She realized that she was being trained to treat the symptoms of disease and its end stage complications while failing to address its root cause. Inspired to find another path, she went back to school for acupuncture, Chinese herbal medicine, and functional medicine. She specializes in complex chronic medical conditions. So I would say, you know, Lyme disease is one of those. So,
Oh,
Dr. Rowe,
definitely. Yeah,
what what
Lyme is
what would you like to
definitely.
say about Lyme disease and what you see in your medical practice?
Well, part of my medical practice is acupuncture and chronic pain. And I learned very little about Lyme disease in medical school, in conventional medical school. I learned that you get what's called an EM rash, which is a bullseye rash. So a tick will bite you, and then a few days later, you get a bullseye rash around where the tick bit. And then you take doxycycline for a few days, and it's not a problem. But the truth is that Lyme is often not detected early. A lot of people don't get that bullseye rash, and it can cause a multi-systemic illness because the infection causes all sorts of problems. Um, the number one thing it does is causes migratory joint problems. So what that means is 1 week your shoulder will hurt, and then your shoulder will get better, and the next thing your lower back will go into muscle spasm, and then that gets better, and then you have tendonitis of your left elbow. Even though you don't play tennis, you get tennis elbow. And so you'll get this migratory joint pain, muscle pain, nerve pain that comes and goes. And what's interesting about Lyme is it makes an enzyme called collagenase, which basically eats collagen. So it can really destroy the joints. But the classic constellation of symptoms are fatigue, pain, insomnia, and then cognitive issues. Um, and so since I work in acupuncture, a lot of times people will come in with pain, and I'll start to notice there'll be like little signs that flash that make me clinically suspect Lyme. And so when I have a clinical suspicion of Lyme because of a constellation of these symptoms, then we'll start to dive deeper if the patient is interested.
Wow, that's so fascinating because everyone, or most people, believe that Lyme disease, there is this rash associated with it, which appears before the onset of symptoms. So I
And some
just want,
people do have the rash, but a lot of patients don't have a rash. And I would say at least 50% of my patients who have Lyme disease never remember a tick bite. But yes, that's a great picture of what's called the EM rash, and EM stands for erythema migrans, which is your bullseye rash. So you can see in that bottom right picture, it looks like a knee there. Yeah, there's a spot in the middle and then a migrating rash outward. And what'll happen is you'll get the migrating rash out. Now, my husband, a few years ago, he diagnosed a child who was bit by a tick on Fisher Island, and she developed a full EM rash. And the mother was smart, brought her in right away, and she was treated and didn't have any long-term sequela. But Fisher Island is right here in Miami Beach, and most people don't think of Miami as a Lyme endemic area. But we do have Lyme in Florida, and there's been documented cases of Lyme in Florida.
Okay, so then let's talk about Lyme disease when it was first, I guess, identified in a cluster of children and adults in 1975 in Lyme, Connecticut, which is quite far from Miami, Florida. And then let me show you a graphic I
Yeah, and
got.
the interesting thing is the reason why it was diagnosed is there were several children in the same town who were diagnosed with juvenile rheumatoid arthritis, and it was a bunch of angry moms who couldn't get treatment for their kids, and they advocated for their children. And because of the advocation for their kids, there was funding for scientific research, and Borrelia burgdorferi, which is the bacteria which causes Lyme, was discovered shortly thereafter. And it was because of a bunch of angry moms.
Right. And then, what inspired me in part to have this interview with you is Robert F. Kennedy Jr. in December had a press release where the Department of Health and Human Services, where he is secretary, is going to devote resources to diagnostics and treatment, which I think is fantastic from
No, that's so
1975.
important. Yes.
Yeah,
And
from
because
1975 to 2025 to really finally have this disease looked at, I think is really a good thing. So, um,
Yeah, and the problem is if you order a regular test from Quest or LabCorp, which looks at antibodies against Lyme, it misses 50% of cases.
wow. So I'm sure you have, you understand that, you know that, and that's so helpful in terms of getting an accurate diagnosis. This is, Miami, Florida's down here. So
Yes.
this is the cases. I got this from the CDC website from 2010 of reported Lyme disease. And then here it is as we progress through the years. And then, so
Yeah,
in the
well,
last
well,
slide, you can see, the concentration of Lyme disease in the US. And are you seeing that since you started
yes,
your
definitely.
practice?
Yeah. Well, it's hard because many of my patients have chronic Lyme, and my husband and I are both ILADS practitioners, so we're on the ILADS website. So ILADS is a professional organization that stands for International Lyme and Associated Disease Society. And basically, it's a group of doctors that treat chronic Lyme and believe in chronic Lyme rather than just, short course of antibiotics for it. Um, but but some of my patients come in already knowing they have Lyme and having had previous treatment and stuff like that. But other times, like I say, it's the patients who come in who are coming for acupuncture for pain. Often they're desperate to have pain. Yeah, and these are the classic 8 signs and symptoms that your aches and pains may be due to Lyme. So, you have more than one symptom. Symptoms come and go with good and bad days, and that has to do with the life cycle of the organism. Some people have more than one infection. So the classic Lyme is Borrelia burgdorferi, but some people have co-infections, and up to 45% of ticks have more than one infection present. So there's secondary infections called Babesia, Bartonella, Ehrlichia, Rickettsia. And if you have more than one infection at the same time, it can make the symptoms even more complex and confusing. So when I test for Lyme, I use a boutique lab in Germany that's called Armin Labs. And in my personal clinical opinion, they're the best um, infection test in the entire world. They use what's called T cell reactivity testing instead of antibodies. Antibodies are limited because the problem with antibodies is if your antibodies are high, did you have Lyme when you were 15 years old and you were at summer camp and it was treated and it's gone away? Or is it active now? And sometimes it's hard to tell with antibodies. Whereas with T cell reactivity testing, it gives you clinical information that tells you, is it infection active or not? And we use T cell reactivity testing in the United States. We use it for tuberculosis to see if somebody has active TB, but we don't use it for a lot of other infections. Um, but um, but unfortunately, these labs are expensive and insurance often doesn't cover them. So I'm glad that there's some proactive movement from the government to devote resources to finding better testing for Lyme and diagnostics. Um, Often women will have worse symptoms with their menstrual cycle, and after we treat Lyme, the menstrual cycle gets much better. Uh, if people take antibiotics for a sinus infection and all of a sudden their joint pain gets significantly better or worse, often that's like a clinical clue that they may have Lyme. Um, I see a lot of Bartonella. Bartonella is an obligate intracellular pathogen, and it's not just spread by ticks, but also by fleas and mosquitoes. It's also called cat scratch disease, but you don't necessarily have to have a cat scratch to get Bartonella. But with Bartonella, I see horrendous foot pain and often chronic burning urination, or people diagnosed with interstitial cystitis and urinary frequency. And then I have other patients who have babesia, which clinically often manifests as night sweats as well as shortness of breath. And I've had multiple patients where they go to the pulmonologist, they're diagnosed with reactive airway disease. And then once we treat their babesia, all their chronic lung symptoms improve significantly. But Lyme disease is interesting because it's the only disease that actually causes migratory nerve pain, where you have burning nerve pain that comes and goes in all of your um, migratory around your body. So, so
No,
yeah,
that
it's interesting and complex, that's for sure.
hence the name of your medical practice is
Yeah.
Miami Beach Comprehensive Wellness Center. Because it sounds like, a lot of people without this diagnostic and getting a diagnosis and the symptomology is, perhaps presenting differently. They have this pain and all these other, you know, um, symptoms and it's not connecting that they're having, they've contracted Lyme disease. So maybe they're going to all these different doctors and then it's only until they get a proper diagnosis that they're able to realize and get proper treatment. Are you finding that the case? Like
Yeah,
how many
and
people have?
I do see gaslighting. One thing that can happen is um the bacteria that causes Lyme disease, Borrelia, can cross the blood-brain barrier and inflame the brain. And so it can cause all sort of neurocognitive and psychiatric symptoms. And I've had patients who go see their doctor, discuss the pain, and they're prescribed an antipsychotic. And really what they need is to have their their chronic infection treated. And particularly Bartonella, there's known cases where people had manifestations of hallucinations, delusions, even diagnosed with schizophrenia, and then, they're not responding to the typical schizophrenia medication like the antipsychotics, but there's documented cases of people having Bartonella, being treated for Bartonella, and then all of the psychiatric symptoms go away or significantly improve. So it's fascinating whenever I see somebody who's seems very mentally ill. I always wonder, is their brain inflamed from something, from a toxin? So mercury toxicity can cause all sorts of uh, neuropsychiatric issues, particularly mood swings. I see bipolar type manifestations with mercury, and then you treat the mercury and those symptoms get way better. Or there's a variety of infections which will trigger all sorts of neurocognitive issues. And then in children in particular, there's an issue called pandas, which sounds very cute, but it's awful. It's a pediatric autoimmune attack on the brain, which can happen after an infection. Most often, it's commonly associated with strep throat. There's molecular mimicry between the strep throat antibodies and proteins in the brain. So the immune system will accidentally attack the brain. And you'll have like children who all of a sudden exhibit uh, regression. So you'll have like a 15-year-old who seems like an 8-year-old who will come into the office holding a teddy bear. Often there'll be food avoidance and sometimes diagnosed with an eating disorder. Um, and then all sorts of anxiety and obsessive compulsive issues. And Lyme is one of the infections that I see trigger pandas in children. Um, yeah, along with long COVID can do it as well. But yeah, I think it's great that there's more and more awareness about this stuff. And there's a lot of people who are trying hard to help their kids who have this kind of thing. But yeah, and it's amazing, interesting work. And every individual who comes in has a unique case, and I really try to stop and think about their case and what might be going on that's triggering the root cause of the symptoms rather than just treating the symptoms themselves.
Wow. Yeah, no, that's great. It's so complex and there's so many things to consider, when you have a patient come in, presenting. And so, like, what's one piece of advice that you would, or you do give, your Lyme disease patients and, their family, their support system to help them, get through, to the recovery stage? Because it sounds like, when you mentioned gaslighting and for many, many years, they've been, having this symptomology, but can't find the answer, can't find, medical care that addresses the root cause. Like, what do you think that's one really helpful piece of information, for the patients and
So
their.
my favorite piece of advice would be ILADS is the International Lyme and Associated Disease Society. They have two conferences every year, one in Europe and usually one in the United States. Last year's was in Texas. This year's is going to be right outside Washington, D.C. But ILADS is great because they invite scientists, they invite medical practitioners of all types, naturopathic doctors, acupuncturists, MDs, nurse practitioners, and then they also have patients there, and they're inclusive of everybody. And they have intrinsic support, and you can find a doctor who's trained by them. So I would recommend anybody who has a clinical suspicion that they may have Lyme, go to ILADS. The other thing I strongly suggest is one of my mentors was Dr. Richard Horowitz, who is now retired from practice. He just now he's writing sci-fi novels and doing research. But he was one of the best Lyme practitioners in the world in Poughkeepsie. And he got into it because his wife was sick with Lyme and he couldn't find anybody to help her. But Dr. Horowitz came up with this questionnaire that's called the MSIDS, which stands for Multiple Systemic Infectious Disease Syndrome. Again, MSIDS questionnaire. And it's a questionnaire that you take where you rate your symptoms over the past month and then you add it up and it gives you a total. And if you're over a certain number, there's a high probability that you have Lyme. And so I have that questionnaire as part of our screening tool when we come into the office. And I can give you a PDF that we can link to this YouTube video that's easy for people to download the questionnaire and you can just fill it out. But it takes time. You really have to stop and think about your symptoms. It takes about 10 minutes to properly fill out the questionnaire. But it can be helpful clinically to know if you need one of those expensive tests from Germany, from Armin Labs, or if you need to look at other um, problems that may be medically driving, your symptoms. But those would be two pieces of advice I would recommend.
No, thank you so much. It sounds like, with the lab in Germany for the testing and, the CDC information about Lyme disease is only presented on data on the US, but it sounds like it's a global disease. It's spread from Lyme, Connecticut. And thank you so much for your time, for sharing your observations. Here's the contact information for Dr. Emily Rowe. She's in Miami Beach at Miami Beach Comprehensive Wellness Center. So, yeah, thank you again. So appreciate your time and your sharing.
Oh, this was lovely, Susan. Thanks for taking the time to chat with me. It's an honor to be here.
Thank you.